We will review how to complete the stairs based on how your home is set up. If you have a railing, we will use a railing to complete the stairs. If you do not have a railing, we will go over how to complete the stairs with both crutches. First, we will face the steps and put your crutches in one hand, opposite of your railing. Then we will reach for your railing. We will be as close to the step as you can. Step up with your non-operated leg, followed by your operated leg. And lastly, bring the crutches up onto the step with you. Non-operated leg, followed by operated leg, and the crutches are the last to bring up. Non-operated leg, operated leg, crutches. Non-operated leg, operated leg, crutches. To come down the stairs, the sequence is reversed. You will bring the crutches to the next step first and come down with your operated leg, followed by your non-operated leg. Crutches, operated leg, non-operated leg. Crutches, operated leg, non-operated leg. First, the sequence is the same. You will have a crutch in each arm and you will step up with your non-operated leg. Pushing on the crutches, you will bring your operated leg up and ascend onto the top step. And then bring the crutches up. You will continue the sequence until you have completed the stairs. Non-operated leg, operated leg, crutches. Non-operated leg, operated leg, crutches. Non-operated leg, operated leg, crutches. It is the same sequence, bringing both the crutches down first, together, followed by your operated leg and your non-operated leg. Crutches together, operated leg, non-operated leg. Crutches together, operated leg, non-operated leg, until you have completed the stairs.